You're listening to Unhinged and On Call, where we share the real, ridiculous, and occasionally chaotic side of vet med life. No topic is off limits, and no story is too unhinged. Just honest conversations from two friends who've seen it all. Thanks for joining us, and today we have a really cool guest, Dr. Megan Pratt. We had a super interesting talk with her. I've known her for, probably 15 years now. Originally met her in Wisconsin, and it's been really fun to see her career develop in the way that it has. We learned a lot from her today. One of the major takeaways is that she'd rather work in a prison setting than in general practice. But
yeah, right. Unhinged in a different aspect of veterinary medicine, but in a career pathway, which is so cool.
Completely. And so once you listen to the episode, you'll understand why. This is slightly different. It's less story-based in terms of clinical cases and hilarious things that happen. But it's really cool because it highlights how different our career paths can be. And then especially in those first maybe formative 5 to 10 years post-graduation, we kind of find our way and find our lane. And Dr. Pratt has really found her lane in Texas working for the prison system. And you'll have to listen to the rest of the podcast to know why. But it's got some really cool pieces, especially for veterinary students and those kind of just recent grads getting into the vet med industry. It's all about confidence and kind of how you present yourself. And we hear that all the time, but it's really refreshing to hear it in this light. So stay tuned, guys.
This episode is brought to you by our friends at VetCS, your go-to for veterinarian-developed CBD and wellness products for pets and horses. Founded by veterinary professionals, VetCS offers science-backed formulas made with premium hemp extracts to support calm behavior, joint health, and overall wellness, whether you're in the clinic or out at the barn. VetCS is all about helping animals live better naturally. Want to see what they're all about? Head over to vetcs.com to explore their full line of CBD products.
Welcome, everybody. We're super excited to have Dr. Megan Pratt with us today. Her and I have kind of gone back actually to my Wisconsin days, so it's been quite a while. And then she went through vet school and done a myriad of different things. So I'll let her tell you more about that.
All right, I'm Dr. Megan Pratt. I currently am a clinical assistant professor at Texas A&M University. Yeah, my background's kind of crazy. I grew up in southeastern Wisconsin, met Chelsea and her husband there while getting veterinary experience prior to vet school. Went to vet school at Mississippi State University, graduated in 2018, stayed on for a large animal rotating internship, and then left and entered practice in central Nebraska, where I did mainly cow-calf feedlot work. Was there for about a year and a half, and then during COVID moved to Texas, DFW area, and practiced mixed animal there for about 4 years before coming on as faculty at Texas A&M. So just kind of bounced around a little at the beginning. I think I've found where I want to stay in academia now. But
really?
Yes, love academia. Favorite. It's been my most, I think, joyful experience as a veterinarian. I think we all go through some pretty tough learning curves and things like that when we enter practice. If we decide to enter practice, some of us don't, I guess. But I think this is where I want to be. I think I enjoy the teaching aspect of vet med more than the actual practice of vet med.
Okay. That is so exciting. And also I feel like with your experience, and it's well-rounded, right? You've done kind of everything, horses, cattle, and mixed, obviously, small animal, I think it gives you a lot more perspective as a student. Because I feel like a lot of our professors didn't have clinical experience. A lot of them just went straight from, professional veterinary school and PhD right into academia. And there's a little bit of that kind of ivory tower thing, but it's hard for some students to relate,
Exactly. And I think I think the people that I learned the most from, whether it was in school or out on externships or things like that, were the people who could give me the real world experience. And I think that's kind of what I'm trying, or my colleagues and I in the department we work in are trying to bring back, is that not everything has to be like it is at that ivory tower. you can still practice really good medicine and do it out of the back of your vet truck and not have to question yourself when you go home for the day on if you did something right or wrong just because it wasn't at a hospital setting. So like, and I feel like every job I had, like during my internship, I did teaching because I did an academic internship. But then when I got into practice, I always was looking forward to when the externs were coming. Did we have students like visiting? And it made the practice part way more enjoyable when you got to like show someone else for the first time something cool. I just remember doing that with like you and Brett over at Elkhorn and being like, man, they're so smart and so cool. And I can't wait to be that person too. And now it's like, I don't feel that smart, but like they look at you that way and you're like, okay, that's pretty cool. But
I must be smart.
How rewarding. It's
Yes.
so cool.
exactly.
What a journey you've had. That's so impressive. That's
Yeah.
so interesting. You've gotten to do everything. Like, that's, that's so neat. I love that.
I don't-
Well, tell me how from your urgent care practice in Texas, like how did the faculty position come up, or how did you find out about it?
So I think what happened was I was at a very large mixed animal practice just south of Fort Worth. We ran on no appointment. We saw every species. We had a large cattle barn, we had a large equine barn, and then we had a pretty substantial like small animal clinic. We didn't turn really anything away. It was kind of like a first come first serve, but we did triage a little bit. And at that time, I had a close friend from veterinary school who was doing his ABVP equine residency at Texas A&M. He was finishing up and he heard about an opening that he thought might be more fitting for me. I had been toying with the idea of leaving that mixed animal practice, mainly just because of the work-life balance. It was extremely fast-paced. If you wanted, it was kind of like on a pro sale kind of contract. So if you wanted to make money, you had to see a lot of things. I probably was seeing anywhere from like 40 to 60 patients a day. I didn't feel like I got a lot of a day. Yeah. Like, I don't feel like I got a lot of follow-up on anything either. So it was just hard. And we had an internship program at that clinic, and I had told him that like that was the most enjoyable part for me, was like more of when I was on call and on after hours with those interns, those new grads, and getting to like actually spend time and teach them when it was like an after hours case and we could kind of set our own pace versus what the pace was during the workday. And he was like, well, I think this position that opened up here at A&M would be perfect for you. And it is with the Texas Department of Criminal Justice. Texas A&M serves pretty much 100% of their veterinary care. Texas still has working prison farms. They provide somewhere about 30 to 45% of their own consumable goods for their inmate population. And we service somewhere around 200,000 to 300,000 animals. That doesn't include our chicken, because we have lots of chicken. We have millions of chicken. But
okay, millions.
Okay.
that would be like all of our like mammals that we service. They have about a 12,000 head cow-calf herd in Texas. I have been deemed, I think, as of right now, we all do everything, me and my two other coworkers, but we service the entire state of Texas. So that's 52 prisons across the entire state of Texas. Yep.
There's that many prison farm? 52?
I would say there's probably about 24 to 26 prison farms, but every unit has like working dogs. So, and we do service the security ops working dogs. So 52 units with all of the security dogs, and then about 25 prison farms.
Wow.
Yeah.
You're still in practice. I mean,
Yeah.
you're like
Oh,
clinically
Yeah.
treating.
And this is, I mean, I don't see any outside clients anymore. My only client is the Department of Criminal Justice. And I feel like and this is a rotation that our senior vet students take. So this is essentially like an ambulatory mixed animal rotation that the senior students take. And we probably get, I would say 85% of the graduating class takes our rotation. The only students that don't take it or can elect not to take it are like the companion animal, so small animal tracking only. Students can elect to take either us, or they can take, we call it TDCJ, or they can take the emergency response team, which is deployed right now because of all the flooding in Texas.
Yeah.
So I probably see out of I think this year's graduating class is close to 160. I'll probably see at least 130 to 140 of them as they come through in their rotation.
How long is their rotation with you?
It's a 2-week rotation. And we pack a lot in 2 weeks. We try to get everyone exposed to our 4 major species of TDCJ, which would be cattle, swine, equine, and then poultry. And then I would say we've done a lot of work on increasing our preventative care measures for the security working dogs too. So they should be able to see everything. So
Are the programs so this is separate, but therapy programs for inmates,
okay.
Is there any interaction with those programs, or is their care separate?
I would say it's a little bit different than what other states are probably doing as animal therapy with inmates. The inmates that I work with inmates every day. The inmates that we work with are more on a hired basis. They are there to provide animal husbandry and care for all of the species that we work with. So it's if they work at a dog kennel, they are responsible for caring for all of those dogs in that kennel. They're also quite involved with the training of certain types of dogs. We have 3 major types of security dogs for TDCJ. We have drug, or what we call contraband dogs. So dogs that seek out contraband and opioids and drugs within prisons. They actually can smell the computer chip in your cell phone. That's contraband. And we have labs that can smell that out, which is really cool.
Wow.
I've hidden my phone in a culvert and watched a dog go get it from a half mile away.
Half a mile?
Pretty much. Yeah. I mean, they were go hide it down the road and she'll find it.
You found it.
A lab.
Wild.
Yeah.
Yeah.
And then we have human scent dogs. So if they're trying to find someone who's missing. So sometimes our bloodhounds will go out for other police departments or the Texas Rangers and help search for missing persons. They're doing that a lot right now with the floods, helping find missing persons. And also if we have an escape happen, they go out and train for that.
I would think so.
And then this is probably I think some of the coolest dogs we have. They still run. If we all think of the Blake Shelton Old Red song.
That's what I thought of when you said Bloodhound.
Yeah.
But that was a coonhound, wasn't it?
Yeah, we have coonhounds that actually run as a package. So I like to describe to the students if they know what fox hunting is on on horseback. We have officers that ride horseback. They chase a pack of hound dogs. And then instead of a fox, it's an escaped inmate at the end. So
man. Oh my God. Wild.
So inmates that work with what we call a pack dog, so the dogs that go out to find an escapee, the inmates are super involved in their training. So if they work at that dog kennel, they're asked to run through the woods and have the puppies chase them. They only interact with the they keep it so that the inmates feed and water and play with those puppies, and that they're attached to people in what is white. Inmates where Texas is white. So they don't interact a whole lot with the officers. They're interacting with the inmates because that's who they want them to chase. And so
interesting. Wild. But also I'm so here for the mental health aspect for the inmates themselves.
Oh yeah.
I love the animal interaction, and I saw this really cool video, and I think it was out of Texas. The name is linking me, so I'll have to maybe send it to you after, or email it to you. But I saw a TikTok. It was a TikTok video. And it was an equine therapy program, and they were the first equine therapy horses to visit inmates and show them proper grooming of horses and equine handling and all of that. It was one of the first and that was probably 2 years ago, I think. It was 2023.
Oh, cool.
But I'll have to send it to you. I thought it was the coolest thing ever. And it made me want to do it. I was I want to go and do that. That seems such a cool thing to do. I don't know. It was inspiring, but.
Yeah, our equine program at TDCJ, we have we breed around 100 mares every year. We have about probably about 1,500 head horses right now.
Whoa.
1,500. 1,500, yeah. I've kind of inherited that gift. So I'm probably like our main equine vet at the moment. Again, we all do everything between me and my coworkers, but like I feel like I've always been a horsey girl at heart. So now here I am back to doing that. And our inmates they are involved in the breaking, training, all of that in our equine program.
Are they all quarter horses?
All quarter horses, yeah. All quarter horses. We have breeding contracts with the 4.6s. And then we
you're breeding nice horses.
Oh yeah, we're breeding
4.6s. Amazing.
Pretty top notch genetics right now. And then we have
for profit. Is that the idea?
What was that?
It's for profit. That's the idea.
The idea is that we need horses currently for our cow-calf operations. So we still work all of our cow-calf operations off of horseback. And then they used to be a very major part of our security operations for TDCJ. That part is a little bit dwindling down, but still necessary. So the idea is that we would raise our own horses, train them, keep them for somewhere between, I would say 5 to like maybe 12 years, and then sell a really sound, really broke horse to the public. These horses have been exposed to like everything. So we do an annual production sale every Labor Day weekend. So that's coming up. We sell 50 good using horses every year, 10 brood mares. And this year we're selling, I think, 7 yearlings. So.
Okay. Oh, gosh, that's amazing. That's a lot of patience. If I think about like our practice, like you've got all the other species as well, but also equine.
But yeah, I mean, and then like I think I was so prepared for this job coming out of that almost controlled chaos of no appointment, mixed animal. That when they were like, "Oh, we run all day for TDCJ," and I was like, "What's new? Like that's still that's what I do now." Except I don't only have to deal with one client, and I don't have to talk about money. Sign me up. Like I don't have to talk about money at all. Like it's all on a
you just have a budget.
Yeah, it's a budget. Yeah, it's a contract base. They buy all of their own product. Like they have their own vet warehouse supply center. I get things that are kind of off the cuff, like that we don't meet all the time from like the school pharmacy, but like that's kind of like case dependent. And then it's very much, I would say, a herd health style of practice. There is a monetary value to every animal, and that's going to depend on if that animal gets referral care or if they stick with the care that we can provide out in the field. So,
for sure.
Right now, I'd say like some of our top tier working dogs and our top tier breeding horses are probably getting the most referral level care, but that's still very limited. I think the past year I maybe referred like 3 cases. Have built really good relationships with.
Wild.
Yeah, I was like I've built really good relationships with some of the surgeons and internal medicine faculty up at the school, and like I can talk them into coming out into the field on occasion and doing things and be like, I could probably set up a little bit of an area to do that surgery if you want to come out and do it. And
that's awesome.
I think that's been really beneficial. I felt like when I was in mixed animal practice, I always was offering referral and I wasn't getting anywhere with it. Mainly because I understand people have a budget for everything. And then when I was really nervous coming back to academia, I was like, man, they're going to want to refer everything. And I'm going to miss that follow-up, which is what I was missing in mixed animal anyway. And, I get complete follow-up now. It's awesome. Like I don't, and I would say too, I always tell my students on the first day, I was like, this is one of your few rotations where you get to do everything. You don't have an intern above you. You don't have a resident. You are the doctor. I'm here as your lovely assistant. I have no need to do these things again. I've already done them. So take this as your opportunity to do it. Or if you have a cool plan that I've never done before, sell me on it and we'll do it. Like sell me on that you've researched it and it's like safe and we're gonna go for it.
Yeah. Cool. What a valuable rotation for up here. Because I like for the time I went to CSU, our ambulatory service was actually quite low. And we barely got to do anything. So for a 2-week rotation, I really didn't. I mean, you didn't get a hands-on experience. So
I also think the liability. the liability is also like
Yeah.
minimal. Like that, it's the state working for the state. It's a state-owned animal. I always tell them too, I was like, if you're gonna make a mistake, you're here with a doctor. This is the time to make a mistake, and we're gonna figure it out, and it's gonna be okay. And everything that's happened like that has always been that way. So, it's been so valuable, I think, for them and their learning. It's also one of the rotations we get the like most feedback on, and they like love it. They want to come back. They wish it was longer.
Yeah.
So it's hard.
Well, you're making
everybody
me
in.
wanna, like, book a flight.
Yeah.
Can we? Yeah, can we come?
Yeah.
Just watch.
100%.
If you
Everybody
need a
come.
technician.
Everybody come. So,
Oh my gosh, that's so cool. That's really, really neat. Okay, so I have granular questions.
Yes.
Okay, so you mentioned 10 to 12,000 cow calf, or at least probably half mature. That has to cover the 52 whatever protein, right? You said it only covers 30% of their consumable.
So I would say the big thing right now is that beef is in high demand, right? So we're actually selling calves to make money.
Oh, good.
So,
okay, good. So there is a profit piece.
I wouldn't say like by no means are inmates in Texas eating steak.
Yeah. Okay. Right.
Like they're definitely cull cows from time to time are passing through a plant for inmate consumption. The main source of inmate protein is coming from their swine operation. They probably have somewhere around alone, I would say close to 100,000 pigs at the moment, and pork is like their main staple protein. So they have their own slaughter facility and processing plant for their swine operation, and that is mainly what's entering into their food chain. They used to have operational dairies. Dairies are a lot of maintenance and a lot of upkeep, especially here in Texas with the heat. So they kind of did away with the dairies and then converted the old dairy barns into swine operations.
Great. Okay. Well, yeah. Okay. Well, this leads me into one of my. So I'm prompting you because I'm so interesting. You're so interested in all that. What's your craziest swine story?
Oh my gosh.
From TV,
craziest swine story? Right. I feel like right now it's so matured health stuff, and I feel like it's just I get a lot of like educating of they hire so many new staff on the egg side to help maintain these people, and not a lot of people come with a swine background. So we do a lot of education that way. I would say we do draw blood on pigs on a very regular basis.
That is the worst job.
It's the worst job. I try to explain to students that if you can do this skill, this is applicable to no matter what part of vet med you go into.
Mm-hmm.
You have a like 600-pound sow screaming in your ear, and you can palpate a single vessel on her, but you can draw blood, but you can find it and draw blood.
Yeah.
You can do anything.
Whenever landmarks you have.
I did have a sow run me over one time while trying to draw blood. I mean, it's no fault of anybody's. It was kind of just like...
Who was on the snare?
Yeah, I was like the trustee. We call the inmates we work with trustees because they have a level of trust to work outside of the main unit. And with the animal. And the snare slipped off. She was a big girl, and she kind of just like plows you over. And I don't know how it even happened. It all happened, I felt like in a matter of seconds. And I stood up, and the students look, and they're like, "You got the blood." And I was like, I don't know how.
You did? No way. You got run over, but you still got blood.
Yeah, I was like literally, it was probably right after I poked her jugular, and she must have had that high of a blood pressure that it just filled my syringe.
Oh my God, it just filled.
And I stand up, and I'm like, here you go. I'm going to go get new clothes now because I'm covered in pig shit. Thank you.
Oh no.
And then we, of course, like walked into Buc-ee's, and we all smell disgusting.
Yeah. You gotta go to Buc-ee's.
Now I'm hungry.
After handling pigs, you have to go to Buc-ee's.
Yeah.
I'll take a pulled pork sandwich.
Yeah.
Place.
100%.
Take
That's
that pig.
exactly what I want.
Yeah.
Yeah, I don't feel like I've had that many.
Well, no, that's a good one. You didn't get hurt?
No, I've literally, I don't know if I just like rolled and tucked and I'm just in between the legs of the sow. I mean, anything can happen.
Maybe
I kind
she
of
really didn't want to get you.
Yeah, I was like, I think she just wanted to get away from the snare, honestly.
I
And
think so too. Okay.
that's
In
just,
some ways they get you.
Are
yeah,
they,
and it was
are
like,
they intentional? Because I don't know a lot about like horses
Well,
are intentional when they want to be sometimes, right? Or pigs the same.
They can be if they're not.
I
If they're
think,
mad.
I think
Yeah.
they can, I
Yeah,
think they
abhor,
can,
yeah.
but, I feel like we usually have, we have such great help out at these places that those incidences are few and far between. So,
Okay.
and most of the time I always tell them too, I was like, I'm more here about like the safety of my students than like my own or anybody else's, because there's a lot of paperwork involved if a student gets hurt. So I'm
Oh
like,
my gosh.
Absolutely.
I will
I love
always
to do
paperwork.
I will always defend.
Rather get
I will
run
always
over.
like sacrifice myself for the student, because I'm not going to fill out paperwork for me, but I'm
Diving in
for the
front of
students.
pigs. Yeah. I don't want to do that. So
Horse starts kicking. Megan's like,
yeah.
Yeah,
That's great. No paperwork.
incident report.
Wild. Wow.
yeah.
My goodness.
Okay, so next one, and well, I don't, whatever's not confidential, I guess. What's your craziest inmate story? Like, there has to be like, there should
Yeah.
happen sometime.
To be honest, I'm very privileged in the fact that the inmates that I get to work with on a daily are not violent offenders.
Yeah.
They are currently close to or approaching a parole date or in a release date of some kind. It could still be years down the road, but they've served the majority of their sentence and things like that.
Okay.
Yeah.
Every single inmate I've worked with has such an interest in what veterinary medicine is. It's insane to me. Like, they just either don't know, they don't know about like even the opportunities that they could have had now that they are working with animal like husbandry and care, that like they could be a vet tech, like those were things that were on the table for them. And they just like didn't know that like being a vet tech for an equine vet is a thing. And now they're out here working with horses every day and they're helping me. And I'm like, I need you to bandage that leg. And they're like, what? And I'm like, well, we're going to teach you how to do it right now, because I can't be here every day. So you're
Hell
my,
yeah.
you're my technician or
Yeah.
my assistant now.
Oh.
And they get so excited just to learn those things. I've been working on starting at least a certified veterinary assistant program for them. They get,
Ooh.
yeah,
That's
it's a
amazing.
course here in Texas for high school students. Like
Yeah.
the Texas Veterinary Medical Association's already doing that for high school students. I'm like, these guys are getting hours and hours of animal husbandry
Yeah.
care. I'm teaching them how to do things like bandaging. At times, if I don't have students, like right now in July, because it's so hot, we don't take a whole lot of students out with us every day. I've had to be like, are you okay with radiation exposure? And, helping me take an x-ray of this
Take some
horse's
meds.
leg today. And they're like, yeah, what do I do? What do you want me to do?
Oh.
Like,
That's so
you know,
cool.
and I go through the handbook with them. We talk about safety when it comes to all of these things. A lot of times too, I have even taught a handful that are at some designated units about like handling sharps, doing things related to that. But it's pretty rewarding. I would say the only times I've never had a bad interaction with an inmate.
Okay.
Yeah.
I have never even had a student feel uncomfortable or anything like that with
Okay.
them, which is
Yeah.
awesome. I will say I have like more uncomfortable interactions sometimes with some of like the bosses, but
Yeah.
it's like you
that
go
tracks.
talk to their boss and it's what kind of like
Yeah.
just like handled, and it's never escalated into more of an issue. I think
Okay.
that's true just for like any woman in veterinary medicine though. Like we all get those interactions with like I work in a setting that is 99% male, and I did that when I was in cow calf and feedlot, and I would roll onto a feedlot and I would say I had worse interactions with like feedlot cowboys and feedlot managers and cow calf people than I have in prison, and that's saying something that I would rather
That
go
is
to
saying
prison for.
something.
I was like, I would rather go
1000%.
to prison every day and interact
Yeah,
with
no
those.
kidding.
Yeah.
Call that out. Yeah.
Totally.
I think just like
Yeah.
how my career has kind of turned out is honestly I kept having these, I wouldn't say terrible, but like really confrontational interactions with clients over and over again. And I know that I am more of a straight shooter. I'm pretty blunt in my delivery of things, but I feel like it's necessary at times. I do try to show compassion, of course, of what the situation is, but sometimes you just have to be really straightforward with someone. And I was always met with resistance that way. And then I was always met with resistance when I first, and like when I left my internship, I was surrounded, the internship I had, I was taught by these strong female professors, like all of these food animal internists that are some badass women in vet med doing amazing things. And I'm like, I'm going to go out into practice and I'm going to be just like them. And then I was just like slammed into these walls with these clients or even past like employers and things like that, and like just not willing to accept me as like a large animal female vet that wasn't doing equine. I think that was like the biggest thing. And not that like women in equine don't hit that resistance as well, because they do. But when you're out there
not nearly as much.
Yeah, when you're out there at a feedlot and they're like questioning you on everything you're doing just because of your gender, it's really tiring. I think that's why I didn't maybe last as long at that practice, as much as I loved that practice and thought that was where I was gonna finish my internship, leave there, and be like, this is where I'm gonna be the whole time. It didn't turn out that way, just mainly because of the pushback I was getting from like the medicine I was trying to perform, and then just not being trusting of a female practitioner. So I think, like you said, I was like, I would rather be with an inmate. I don't need to know what he did. It's public information if I wanted to, but he's respectful to me. He wants to learn from me, and he wants to do what's best for the patient in front of us. And I think that's amazing. I wasn't getting that in practice. I wasn't even getting that from owners half the time, let alone like managers. So,
I mean, that brings up a great point, is that it's whether it's gender related or age. Like I remember I have kind of a baby face, but so for the first 10 years of practice, people were like super condescending at times. And unless you have, especially in small animal, when you don't have a relationship built up, like people can be really awful, condescending, and say shitty things. Yeah. And then we wonder why like a lot of people don't stay in vet med very long. Is people are really disrespectful to young veterinarians, female veterinarians. I mean, you can insert any adjective, but it's crazy, because I did do that time in the dairy, and you show up to a farm for a calving, and you know there's 300-pound men, and they like look you up and down, and they're like, what are you gonna do? And then fucking 10 minutes later I have the calf out because I can fit and manipulate this thing. Exactly. And then you earn respect,
right? Like,
but
it's
you
never
start out with that. You know, it shouldn't be that condescending, I guess.
I would say
it's discouraging.
Yeah, I would say one of my favorite stories of my current position was I started at Texas A&M in May 2023. It was rotation 1 of the class of 2024. I had this awesome group of female students. And only one of the students out with me, I think I had 3 students out with me that day. Only one of those students was kind of large animal focused, wanting to go into production medicine. The rest were like small animal or mixed animal tracking. And we were palpating cows out at the Ellis unit, which is a really big unit here in Texas. You'll hear there's songs written about it. And they have it's probably close to like a 600 or 700 cow herd right now. And we were doing pregnancy palpation, and we had a cow get down in this like really solid wooden alleyway. She's kind of like rolled up on her side, and you know, all these cowboys that work at the unit, all these inmates are like out there, and they're like, we can do this, we can get her unstuck. And I'm kind of just looking at her, I'm like, this is why we take physics getting into vet schools. What I always tell students is like, it's all about the angles, where you need a lever, where you need to pull. And I get this cow. First of all, I climbed, don't do this, FYI, but like I climbed down in a solid alleyway. I palpate her while she's down. I draw blood on her. And then I climb out and I get the ropes on her the way I want them. And then I get everybody pulling her the way I want. And then we get the tractor over, and we literally hoist her up and over the side of the alley.
Wow.
And all of my female students look at me and they're like, that was awesome. Like they were going to do stuff and probably kill and probably like hurt or like
they hotshot the shit out of her, and then
trying to get her out, and you just like made everybody stop and listen to you and get it done. And I was like, I think you just have to be confident in what you know. And it could be anything. It could be like, I know that this is the right diagnostic test we need, or I know that this is the right course of treatment. And you just have to like convince those people that this is what you need. And I remember after that, I had all the bosses come up to me, and they're that was awesome. Like, we would have never thought to do it that way, or we would have never, and I was just like, sometimes we know some stuff, like,
Yeah.
that was
your space.
yeah, and that
good
was like
for
my
you.
first time like going out in the truck without one of my coworkers as like more of a training kind of like time. And
Okay.
it was so cool just to see like the students really be receptive to like, oh, a girl can do this, and like not be
Heck yeah.
afraid to tell these guys to like stop what they're doing and listen. And it all turned out safe. No one gets hurt. The animal is fine, so forth. Like, and it's just, I think that's like so cool, is like, I like being that role model, but I also like when the students step up and almost do that themselves too. Like, I see them build confidence in things like just pregnancy palpation, that to the point where they're like calling the cow bred before I'm even getting a chance to look at the ultrasound. And like and then all the inmates and like bosses are like, she said it, we're doing it. And they're
That's
shocked
what it is.
going. And I'm like, that's how you have to say things. We were always told the students to like say it confidently, and people will believe you. And I'm like, yeah. Also, like, be ready to back it up when they don't, So
Right.
and defend it because it's the right thing. And I think that's more what I kind of tell my students these days is, I just want you to be confident in your skills, and this is the chance to practice those skills. So go for it. And and most of the time, meet me around. I will say that too. I was like, most of the time you don't.
Well, once they get the confidence, because I do think leaving, especially going fourth year, I think middle of fourth year, I felt a little better by end. I was like, okay, if I didn't do an internship, I'd still be okay. But you don't have that confidence, I guess, until like for me, it was really end of internship where I was like, okay, I can be on my own and like be totally fine. But you do, I mean, I hate the saying fake it till you make it, but it is that feeling where you just have to have confidence in yourself. But so many students don't get that, and they just get beat down by clinics, and then they're like, they leave and they're so timid. And of course, people are going to eat you alive because they can tell.
And then you have people leaving the field, right? Then you're in this whole conundrum of, what we're in now, shortages and all of that. You're being an amazing inspiration for people to actually want to like be more emboldened and confident and probably stay in it longer. Like to have a role model of who you looked up to previously. Now you're that for other people. And that is really cool.
I also think for the things that I've seen in like what I want, I feel like students are coming into fourth year with less and less clinical experience. And maybe that's just the way vet med is kind of trending, and COVID probably had a lot to do with that too. I just want them to get back to like feeling confident about stuff. And like, I also want them to know that doing an internship, I didn't do an internship thinking I was going to go be a specialist of any kind. I did an internship thinking I might enter rural practice. I might have to be alone in a truck. And I want to say that I've seen some stuff and done some stuff. And that like fifth year of vet school of an internship was that for me. My faculty at Mississippi State allowed me to kind of just take the truck and go do and learn on my own, and like, hey, call me if you have a problem. And that was such an inspirational thing. And I think that's kind of where I'm at. Like, I mean, sometimes I think the students might get a little frustrated with me if I'm like off to the side while they're working on a case, talking with the farm manager about some stuff on the farm. But I'm doing that because I want them to have the opportunity to do everything and then come back to me with their plan and findings of the patient. And I can just be like, I agree with you. Go forth and like, let's do this together. But you don't need me there to watch you do a physical exam. Like, you're a fourth year vet student. You know how to do a physical exam. I was there.
You're capable.
So,
well, kind of a crutch, right? Until the crutch is gone, you don't, like, it's easy to rely on other people that are always standing there and close by, and they don't need it, but you do have to, obviously,
I will say now, I rely on the students for my medical records. I was on last week by myself without them, and I'm like playing catch up on my medical records.
No, that's the worst part.
They're usually there, and they're like, one's like dictating to the other, and the other is scribing while they're doing the whole thing. And I'm just like, oh man, I don't have that person right now. I guess.
Wow.
This is where voice memos come into handy.
Yes. Well, at the volume that you're handling, There's like, I can't imagine the note taking and the record keeping.
Right. Spreadsheets
Dictation
are
is going to be the
Yeah.
whole AI plus dictation. Like game changer.
Absolutely.
There. 'Cause it's like
Sure.
even, and it's hard with herd health, but some of the programs now where you can set a tablet or a laptop in the exam room if you're a small animal, and it records the whole thing. And sometimes some of them can even keep, if you use names well, it can keep the patients of the small appointments separate. But like for horses where we're not in the exam room and things like that, and then herd health, I don't know how you know, outside of dictation later. I don't know
Spreadsheets.
how you do all that.
Spreadsheets are your
Spreadsheet.
friend in herd
Yeah.
health. I mean,
That's
Excel
cool.
spreadsheets.
Yeah. Yep.
But I will say,
Well,
like,
because I guess billing you don't have to worry about. You bill by your
No.
time, like to the state. Or not
I don't bill anything.
Because you're just salaried, I guess.
I'm
Oh,
a fake contract employee. So,
okay.
Huh.
yeah.
Yeah. You just do. That's
They
cool.
already, yeah,
Well,
they
well,
already
very
paid.
cool.
They already paid for me. They already paid for the equipment in my truck. That's what I tell the students
Yeah.
all the time. They're like, I don't know how this is right now, but like at Texas A&M, our students don't get to take a whole lot of X-rays like themselves. Like they get to do it on models and stuff, but they don't get to do it on like live patients. And if I'm taking X-rays in the field, I'm telling the students to take them and take as many as you want. The company is, or like TDCJ has already
It doesn't
bought.
cost anything.
Yeah. They have already bought the machine. They already pay for the maintenance of the machine. Take as many as you want. You don't like that chat, retake it. Like, take
Learn
a
now.
good quality
Yeah.
X-ray and appreciate it.
With your whole career already. Like, I don't know. And I'm just so impressed. And that the whole Texan system seems amazing, really, for all parties. Like, it's just beneficial and all front. Yeah. Which is cool. That is neat.
It's such a fun environment. I really have I have two great coworkers, Eric Canacey, Katie Maples, and then every single livestock boss that I work with, I don't have anything but nice things to say about. Like, I think they do a great job with their herd management, and they are on a limited kind of budget and things like that. And for what they can produce and still do, it's pretty amazing. I mean, I wish that I had. I think this would have been like a really fun rotation when I was a student. I
want to
go now.
Like, I don't think I would.
Like I said, I'm booking my flights to come visit you and hang out.
I don't think I would have wanted to leave academia if I would have known that this was like out there. And with so many of these new schools doing this dispersed education kind of thing, I worry about like what every student's clinical experience is like and how can we make that a uniform way of teaching. And then, but yet, like, I'm out here in the field and I'm doing crazy things. So like, I wouldn't say it's necessarily uniform, but like, we really do try hard to have kind of the same discussions with the students every rotation. Like, we talk a lot about regulatory medicine, just because we deal with a lot of that here in Texas. And then, I mean, we are, I would say, like the herd health rotation that every student gets to, because we're even managing our horses and our dogs as a herd. I mean, I do still treat the individual when I have an individual case, but like, I'm making decisions for everything based on a herd too. So like, if I'm talking about referring a working dog, I need to think, I'm like, well, if I'm referring that working dog in and it's looking like it's going to be 10 grand, well, that's 10 grand. Now I don't have to treat the other like 900 and some odd dogs that the state owns.
Yeah.
So, and it's kind of back to like a shelter med, like I could do more if I didn't treat this one for the greater good. So, but
well, so I don't know. We're so thankful.
I know.
For your time.
This was so much fun to listen and learn. Like,
I mean, like I said, I'd rather work in prison. So you can imagine some of the things I've had happen.
I love it.
So
I'm here for it.
I think that's the safe end.
Hell yeah.
She gets treated. You get treated better as a female vet in prison than you do in clinic.
Yeah. Well, thanks for everything you do. Like, seriously, it's very inspiring. It really is.
Well,
And you found your people.
I mean,
like it's a good supportive environment to work in.
Yeah,
It's very
absolutely.
cool. And it's just a cool avenue. I don't think I don't know that anybody else that works in a system
Me-
like that.
no.
So it's really quite cool.
It's really cool.
No. And like I said, we love like having people know. I feel like TDCJ, Texas Department of Criminal Justice, we're one of the best kept secrets of Texas, let alone of of the US here. They're doing really great things. They're giving inmates job training. They're coming out with a set of skills that they didn't have before. My students are getting the opportunities to do and learn things that they probably wouldn't have had the chance to do up at the hospital in College Station here. And I literally love coming to work every day now. And I don't feel like we get to say that a lot as what's from time to time. And even if I'm alone and it's a crazy day and I probably drive about 2 hours every day too. We drive pretty far. And I don't care if I just drove all the way out to Huntsville and I drove all the way back to College Station and you're calling me with a call. Like I'm gonna go back. Like that's my job. And I really do. And I'm really proud of everything that they're doing. And I just have nothing but really, it's so fun. If you guys see a horse, our brand is usually a number over a star on the left shoulder. They'll have another set of numbers in their hip and their butt. They're all over the country now. I'm on like the Texas prison horse page and I see them in Colorado, in Florida, like they're doing everything. And I just feel like so blessed to be a part of that system. And I think
so cool.
That's also what students get to say too. Like if they see something like that or hear something about, oh, this inmate escaped and these dogs chased him down and they caught him and like they were involved with like helping care for those animals and it's so and so are the inmates. I feel like I don't judge anybody. These guys made mistakes and they're on the path to doing better. And if I can teach them a skill, whether they get to apply that in like a future career or if they just get to apply it to their own future animals and pets, that's what it's about. So
Right. Yeah. Right. I love that so much. You're surrounded by people that are trying to better themselves.
Well, right. Exactly.
That's
exactly.
amazing. Yeah. Mm-hmm. Wow. Cool. Well, thanks for everything you do. Seriously.
Oh, thank you. Yeah. This was so fun.
It was so fun.
Good to see you.
Yeah.
See
Thank you so
you.
much. All right.
Thank you.
We'll see you in Texas. We'll come.
Yeah. Texas.
Yeah.
Perfect.
Bye, Megan.
Thanks for tuning in and make sure you subscribe so you get all the latest updates. Unhinged and On Call isn't just a podcast. It's a lifeline for every veterinary professional barely holding it together with vet wrap and caffeine. Somewhere out there, another tech, vet or assistant, is deep in the same chaos, dodging poop, managing meltdowns, and wondering if they're the only one unraveling. You're not. Whether you're laughing, crying, or rage cleaning your truck, you've got a whole tribe behind you. You're unhinged, but never alone.